Treatment principles, attacking root of illness. In attacking the root, the physician seeks to identify the root, that is, the basic nature and cause of the illness and its principal abnormalities, and to devise appropriate treatment aimed at the root. This is one of the most basic of CM therapeutics. In contrast, the appearance is secondary. It is the response to or the result of the root. In general, the root of an illness mostly refers to its cause, the activities of yin-yang, and the mechanism of the illness. In complex illnesses, the root also points to a pre-existing illness or the primary illness before complications set in. The appearance refers to the symptoms, which may be urgent or not, and temporary or long-lasting. In complex illnesses, the appearance also refers to the secondary illness, complicating a pre-existing disease or the secondary changes flowing from the primary illness. In illnesses in which the exterior and the interior are simultaneously affected, Chinese medicine often regards the exterior effects as appearance and the interior effects as root. Since illnesses evolve continually, the root and the appearance are not fixed throughout an illness. Occasionally, they may even reverse their roles. The concepts of root and appearance are quite broad. When applying the principle in treatment attack the root, the physician must pay attention to the following two important aspects. When urgent, treat the appearance. So when an acute illness develops, there may be certain symptoms that are urgent or life-threatening. In such a circumstance, it is appropriate to treat the urgent appearance first. For example, when a patient is bleeding profusely, the first goal must be to stop the bleeding, whatever the cause of the bleeding may be. Only when the bleeding had been substantially controlled and the vital signs stabilized should the physician take time to ascertain the cause of the bleeding and devise treatment aimed at the cause. In some patients with abdominal distension and severe constipation or edema with oliguria, it is necessary first to promote defecation or diuresis. If the urgent symptom of constipation or oliguria is not taken care of, there will not be a path for the pathogenic evil to leave the body, and any treatment of the root cannot achieve results effectively. In certain chronic or less urgent illnesses, there may be residual illness. Often, genuine qi is deficient so that endogenous pathogenic evils cannot be repelled. In such an illness, it is appropriate first to eliminate the exogenous evil to prevent further damage to genuine qi. Also, in the early stages of an exogenous illness, it is appropriate to exploit the fact that the exogenous evil may not have consolidated its position. If the exogenous evil is attacked vigorously at this stage, often the illness may be cured with half the effort. In the circumstances described, paying attention to the chronic condition while ignoring the expansion of exogenous evil effects is not the best approach. In the approach of attacking the appearance when urgent, the treatment goal includes paying attention to the relationship of the root and the appearance of the illness, and especially placing the patient's life at the top of priorities. Throughout treatment, the physician aims to minimize the risk to the patient's life caused by the illness. Second, when not urgent, treat the root. This approach is applicable in most illnesses and during convalescence from an urgent illness. The goal is to eradicate the cause and pathological implications of the illness thoroughly. For example, a person with a chronically deficient constitution is highly susceptible to exogenous pathogenic agents. When such a person falls ill with an urgent exogenously caused illness, it is appropriate to treat the exogenous illness first. During convalescence from this exogenous illness, it is then appropriate to treat the underlying weakened constitution methodically. In other circumstances, such as relapse of the original illness or further progression of an illness, the physician must also give treatment of the original illness an important place, so that the entire illness is treated systematically. Third, simultaneous treatment of root and appearance. When the root and the appearance are equally weighty, or when the root and the appearance are inextricably linked, then the appropriate and most effective approach is to treat both simultaneously. For example, a patient presents with fever, hard abdominal distension with pain, dry constipation, dry mouth, and dry tongue with yellow coating. This syndrome indicates that the illness is one of injury to in fluids, permitting accumulation and gelling of heat in the interior. In this case, the deficiency of yin fluids is the root, and the heat effects in the interior are the appearance. Since the two are equally serious, the approach to use must be to induce defecation and nourish yin simultaneously. Only by doing so will the physician eliminate the heat evil from the body and avoid further injury to yin fluids by catharsis. There are certain exogenously caused illnesses that progress slowly, but the pathogenic evils persist because genuine qi is too weak to dispel the evils. In such illnesses, it is appropriate to augment qi, treating the root, eliminate the symptoms, and secure the exterior, treating the appearance at the same time. Doing so has the added benefit of eliminating the exogenous evil more rapidly. The simultaneous treatment of root and appearance does not mean lacking priority or regarding both as equally important. Sometimes the emphasis is on eradicating the root without neglecting the appearance, and sometimes it is on resolving the appearance without neglecting the root. The relative emphasis is determined by the actual circumstances of the illness and the relative importance or severity of the abnormalities. Thus, the application of the principle is flexible and adaptable. Thank you for your attention.